All right, so today we're going to start in our section on the problems of health and medicine, particularly in US society. Obviously, this is a major issue today with a global pandemic. But on our first video, we want to start by breaking down some of the key terms and ideas to get through before we dig into the problems of the US system in the next video. So the first thing we need to think about is how do we define what's healthy? What is pathological? Pathological is not just means a pathological liar. What it means is diseased or problematic in some way. So a pathological liar is someone who can't help from lying. It means it's unhealthy lying. The important thing to think about here is that what is healthy and what isn't necessarily about our biology. It's not about how much um, sugar is in our blood necessarily. Yes, there are certain points where chemical and biological factors do affect our ability of our body to function. But we need to recognize that what we define as healthy and sick are socially determined. For example, if we look at this chart on the right, um, in 2017, people whose blood pressure was right at 130 would have been considered or pardon me, at 140 would have been considered right on the line for high blood pressure. But in 2018, they lowered that line. Why is this important? First off, we want to think about who is it. It's an association of doctors in a conference somewhere. But with that simple gesture, that red line of high blood pressure would go down to 130. So there's probably millions of people in that group who are now have high blood pressure as opposed to pre-high blood pressure. And there's a lot of things that stem from that. So why do we make this change? Why does this matter? All of a sudden, people who yesterday were okay are now in trouble. People who are healthy are now sick. So what are some other examples of this? Plenty throughout history. Homosexuality, for example, used to be considered a pathological or a mental disorder. People who practiced homosexuality were considered to be mentally ill. As we can probably guess, this wasn't just a question of diagnosing and not diagnosing. This served heterosexual white establishment very well. Right? It helped keep people in the closet. It helped keep heterosexuality as seeming as normal because people didn't want to be labeled as mentally ill. Again, what's healthy and what's ill is a social construct. It depends on your society. There's myriad instances in which doctors have traveled to different countries to study something like bipolar. French doctors flew to Argentina to try to study bipolar disorder in communities in Argentina. But they found that it really wasn't diagnosed there because what they diagnosed as bipolar was seen as something to keep within the family and not seen as a mental health problem. It really depends on where we are and when we are. It depends on society. So what social factors affect health? This is one of the key things we need to think about today. How does society affect the functioning and the well-being of our body? Epidemiologists and medical sociologists talk about what they call proximal and distal causes. This is just a fancy way of saying indirect and direct causes. For example, studies have shown that the experience of living in a racist society raises the constant or chronic stress level for Black individuals in America. The threat that someone's going to say something, that someone's going to pull you over, the threat of violence, and the threat of those microaggressions, those everyday little racisms people do. That creates a kind of chronic, constant stress. That stress isn't just a mental thing, it affects our body. It releases adrenaline a little bit into our body. This in turn means that immune systems are weakened, blood pressure is heightened, and so there are chronic conditions in the Black community that come from living within a racist society. So that social factor racism directly affects health by creating stress. We can also think of indirect causes. Um, Poverty certainly can create stress, for example, but living in a poorer neighborhood further away from a hospital can also affect our ability to get care. Our ability to pay for a doctor indirectly affects our ability to get care and thus our overall health. As we move through thinking about things like a global pandemic and particular issues in society, we can think about these proximal and distal causes. One classic study came from Frederick Engels, who is famously known for collaborating with Karl Marx, but did a number of studies of his own, looking at the condition of the working class in England. This is often thought to be one of the, primary sociology of medicine texts. Conducted in 1844, he found that morbidity is 4 times higher in industrial cities. This is where the working classes lived. And mortality was 10 times higher. What does this mean? Morbidity is just the prevalence of disease, how many people are infected with a disease. For example, in poor Black communities, we see the condition of diabetes is much higher. So the morbidity of diabetes is much higher in those communities. Mortality means the prevalence of death, how many people are dying and when are they dying. The prevalence of both of these meanings, how often do these occur? So let's think about this for our discussion question on the board. Why is it that living in industrial England in the cities, we would see such astonishing numbers as 10 times higher mortality rates and 4 times higher morbidity or disease rates?